welcome back. Today we'll demonstrate the arrangement of mandibular posterior teeth. Now, when we start arranging the mandibular posterior teeth, the way the teeth will occlude in centric and eccentric will be evident. Now, when difficulty is encountered either in setting the mandibular posterior teeth in centric or eccentric, check the maxillary teeth for proper placement. Often, errors in arranging maxillary posterior teeth may not become evident until mandibular teeth are set. Now, we already finished the arrangement of mandibular anterior teeth, and you can see that we can achieve edge to edge and tip to tip in lateral and protrusive movement without the separation of the pin from the incisal guidance table, and we have the zero line as we determined the vertical dimension of occlusion. Now, as I mentioned just earlier, before we start arranging the mandibular posterior teeth, we have to check the maxillary posterior teeth. We replace the occlusal table and close the articulator, and we check the anterior posterior compensating curve by observing the elevation of the buccal cusps starting from the first premolar to the second molar on both sides, as you can see here, and all the criteria of the setting of the maxillary posterior teeth must be observed and checked. And we check also the centric position. The vertical dimension is preserved by the incisal pin. Now we replace the mandibular cast again. You can see here we start setting the mandibular posterior teeth. Now, we start setting the mandibular teeth with the first molar. We pick up the lower first molar and we take small piece of the display wax, put it in the centric fossa or central fossa of the mandibular first molar, like this, and we put the first molar, mandibular first molar, in a class 1 relation with the maxillary first molar, and you can see that the buccal cusp of the mesiobuccal cusp of the maxillary first molar articulates with the buccal groove of the mandibular first molar, and you can see that the buccal cusps of the lower molar, which are considered as functional cusps, occlude in the central fossa of the maxillary first molar, and the maxillary first molar lingual cusps or palatal cusps occlude in the central fossa of the lower. Now we close the articulator and observe where are we going to open space for the maxillary or mandibular molar to be accommodated in the wax. Now we remove this piece of wax and soften the wax in the area. So we can close the articulator completely. Now we take a piece of wax and fix the first molar in its proper position in the lower wax rim. You can notice here that the amount of wax around the first molar is enough to accommodate first molar. We fix it in the wax, and also we fix it from the lingual aspect as well. We place some wax from inside and we wait a few seconds for the wax to cool down. And you can see here the amount of vertical overlap between the maxillary buccal cusps and the mandibular buccal cusps. Now this vertical overlap will prevent cheek bite in the finished denture, providing a vertical overlap or posterior overjet. Now when the wax is cold enough, we can open the articulator and remove the display wax from its central fossa and from the buccal palatal cusps from the upper. And you can see now the first molars, maxillary and mandibular, are occluding in class 1 relationship in the centric occlusion. Now we can open now the centric stops and check the eccentric positions. Now the only eccentric position we can check now is the protrusive position, as we do not have yet the right first mandibular molar in its place, so we can check now only the protrusive movement. Now when we put the articulator in a protrusive position, in edge to edge anterior teeth, they represent the working part in this eccentric movement. We have to have a balancing contact between the mandibular first molar and the opposing teeth. Now you can see here we can put an edge to edge without separation of the pin, and we have balancing contact. This can be easily achieved if we have properly set maxillary teeth with proper anterior posterior compensating curve. Now we proceed for setting the mandibular second molar, and you can notice here the line representing the central, the crest of the ridge must pass from the central fossa of the mandibular teeth. Now setting the second molar, we don't need to put it in the same way. We just soften the wax posterior to the first molar and we press it in place. To be at the same level almost. Then we check its relation with the opposing. I think we need to press this molar slightly more. Let me check the occlusion now. We can see that we achieved proper occlusion in the centric position between the lower or mandibular second molar and the opposing maxillary second molar. Now we fix the teeth from lingual side by softening the wax, melting the wax around them, and fill the gap lingually. Now we can, as long as the wax is still soft and warm, we can do minor adjustments, and you have to observe the occlusion from the lingual side. As you can notice here, the maxillary palatal cusp of the second molar occludes in the central fossa of the lower second molar, and the lower buccal cusp, which is the functional cusp, occludes in the central fossa of the opposing molar. Now, the second or the third tooth to be set in the lower posterior teeth is the second premolar. We open space in the wax, soften the wax in the area, and we pick up the proper tooth, the correct side, and you put it in a vertical relation where the long axis of the tooth is vertical, mesiodistally, and slightly to the lingual, buccolingually, and we see that it occludes perfectly in its position, achieving a maximum intercuspation while we are in the centric relation position. The last tooth to be set is the first premolar, and you can notice here that the space available for the first premolar is sufficient to accommodate the first premolar without any adjustment. And this is because we have a broken contact here and a loose contact between, or light contact between, the mandibular or maxillary posterior teeth. Now we fix it in its position, and we can see that it occludes perfectly in its position. Now all what we need is to fix these teeth. We achieved now a very important part of the setting of the teeth, which is the maximum intercuspation coincident with the centric relation. Now the mandible is in centric relation with the maxilla, and the teeth are in their maximum intercuspation. Now we wait few seconds for the wax to cool down. Expose the teeth, clean the teeth, always keep the teeth clean so we can observe the teeth relation. Later, the next step after we finish the setting, we'll demonstrate the waxing up and festooning. Now we fix the teeth from inside, and you can see that the central fossa of the mandibular posterior teeth coincides with the crest of the ridge. Okay, now we close the teeth. Now we can observe, as I mentioned, the protrusive movement. If we put the teeth in edge-to-edge contact, we have balancing multiple points. We can notice that the pen is still contacting the incisal guidance table, and we have an edge-to-edge contact, and we have a balancing contact starting from the maxillary first premolar, maxillary second premolar. As you can see, the maxillary first molar and maxillary second molar. This is simply because we set the maxillary teeth in the correct position, and we gave the setting the proper anterior posterior compensating curve. Now we'll proceed for the setting of the right side of the mandibular posterior teeth to also check and demonstrate how we can achieve the balancing contact during lateral excursions and to demonstrate the balancing and working side. Okay, now we proceed for the setting of the right side. As we did on the left side, we pick up the first molar. We take small piece of the display wax. It is soft wax, it does not harm, and we place it in class 1 angulation. You can see here, as we did with the left side, the buccal, mesobuccal cusp articulates with the buccal groove. Now we close the articulator and we mark the area in an arch form, because the articulator closes in arch direction. Now remove the wax in the area. And we soften the wax in this area, and we close the articulator, and we make sure that the incisor pin is completely touching the incisor guidance staple. Now what we do, we fix the first molar in its position. By melting the wax around it, and also from the lingual aspect we can add some wax, so we securely hold the first molar in its place. And we notice lingually that the mesopalatal cusp of the maxillary first molar occludes in the central fossa of the lower or mandibular first molar, and the buccal cusps of the lower or mandibular first molar occludes in the central fossa of the maxillary first molar. Now these are functional cusps, the buccal cusps of the mandibular first molar and the palatal cusps of the maxillary first molar. Now once the wax is cold, you can feel it's cold, we can open the articulator and you can see that it occludes perfectly, and the central groove comes in within the line indicating the crest of the lineage of the mandible. We clean now this wax, we no longer need it, we can use piece of gauze to clean it. Okay, and we can see that now it occludes perfectly in its position. Now we can evaluate the balancing contact. If we move the articulator backward, we can see that it raises the incisor pin a little bit, so we can lower the anterior part of it slightly. We still have it in good occlusion. Now we have balancing contact edge to edge without separation, and we have balancing contact in the posterior area here. Now we can evaluate here once we set the right first molar, can evaluate the working contact. Now you can notice here that as the mandible moves to this side, this is the working side, and you can see that we have working contact here, and we have balancing contact between the palatal cusps and the buccal cusps of the lower teeth. This will be explained in a minute in a diagram. I will proceed now to set the second molar, the second mandibular molar, as we did in the left side. Okay. I need to reduce the height of the wax a little bit more. Cut here. Now the second molar here, we need to grind a little bit from the fitting or lab surface of the, you can here, you have to grip the tooth firmly between your two fingers so it will not move. Okay, a little bit. I fix it in its place. Usually we don't need to, but sometimes the size of the teeth. Now you can see the pin is closing completely. As you see here, the zero line flushed with the upper surface of the member, and we have enough space here, so I raise it a little bit to articulate with the maxillary second molar in the proper relation. Now I fix it from inside. I have to keep the wax in good shape. Try not to. Now with cold instrument we can adjust the tooth a little bit more. You see now it articulates nicely with the maxillary second molar, and we observe the occlusion from the lingual side. The palatal cusp, as we mentioned, must articulate with the central fossa. The palatal cusp of the maxillary second molar must articulate with the central fossa of the mandibular second molar. So the intercuspation will be effective for the patient. Now we proceed for the setting of the premolars. We put the second premolar. I remove the wax in the area. And soften the wax in the area. I take the second premolar and place it in its position, make a contact point with the first molar, and we can see that it articulates nicely and easily with the maxillary premolars. We fix it in its place by melting the wax around it. Make the maximum intercuspation. Now the last tooth to be set will be the, now I need to fix the second molar, premolar, in its position securely, so it will not move. I have to add some wax here. Now the last tooth to be set will be the first premolar, first mandibular premolar. Now I remove the wax in the area. Soften the wax and place the first premolar, and you can see that it fits exactly in the size exactly, and this is because we have here space, we have here broken contact between the maxillary canine and the maxillary first bicuspid, and you can see that here the tooth, I will fix it in its place, and we here can create the maximum intercuspation with the teeth together easily. As you can see, we have nice intercuspation in the centric relation. As we mentioned earlier, the maximum intercuspation and centric relation, or the centric occlusion and centric relation, and the complete denture, they coincide with each other. We fix it from the lingual side by adding some wax. And you can see that the line joining the central fossa of the teeth is a straight line, and it matches or coincides with the line indicating the crest of the ridge of the mandible. Now we evaluate the balancing contact in the protrusive movement on the right side. You can see here that I can achieve edge to edge without separation, and I have multiple balancing contact in the posterior teeth. Okay, and I want to now check the lateral movements, lateral excursion, eccentric movements. Here is the working side, and you can notice that the pin is not separating from the pin from the incisal guidance table, and I have working contacts between the buccal cusps of the maxillary and mandible, and on the other side I have multiple balancing contacts. Now if I move the articulator to the opposite side, we have here the working side now, and we have multiple contacts in the working side, and we have multiple balancing contact without the separation of the incisal pin. Now this is what we are planning to do in order to achieve balanced occlusion. I will demonstrate now in a diagram the working and balancing contacts you need to achieve. Now, if we have here the maxillary and mandibular teeth, okay, this is the mandibular teeth and maxillary teeth, and you can notice this is the occlusion in the centric relation. Now, when the mandible moves to the right side, this is the right side of the patient, when the mandible moves to the right side, the side to which the mandible is moving is called the working side, and the opposite side in case of the complete denture will be the balancing side. Now, when the mandible moves to this side, the condyle on this side will move inward, downward, and forward. Okay, and it's called the orbiting condyle, and the condyle here will rotate and called the working condyle or rotating condyle. Now you can see if the mandible moves this side working, we have the relation here between the palatal, maxillary palatal and mandibular lingual and maxillary buccal and mandibular buccal. This is working contact. Here we must have balancing contact between the maxillary palatal cusp and mandibular buccal cusp. These are functional or centric bearing cusps. Now, when the mandible occludes in the centric again, if the patient moves the mandible to the left side, okay, we'll have the working contact now in this side between the maxillary buccal and mandibular buccal, maxillary palatal and mandibular lingual, and we have a balancing contact here. It's important to stabilize the denture during the eccentric movement. Okay, now the mandible will move in its back in its centric relation. Now this diagram explained the relationship you need to check on the articulator while checking the, here we have buccal to buccal cusp, and this is called the working side, and we have here a touch between the palatal upper and buccal lower, and you can see that the pin is not separated or not separating from the incisal guidance table. Now, by this we have completed the arrangement of all the teeth. The next demonstration will be the waxing up and festooning in order to produce the polished surface of the complete denture. Meanwhile, have a good time and see you then.